Another one coming through from Nancy. I've had my first recurrence after 3 years. The cancer is on my rectum, and because of that, I had to have my colostomy redone. The doctor will start me on chemo this coming Friday using a combo of carboplatin and Doxil. Reading up, there seems to be some heart-related issues with Doxil. Already I'm having heart issues. I'm getting very nervous. Could you please advise which treatment option is best in my situation? Sounds like that may not be a gynecologic question, but I'll let you have at it.
Well, it is a GYN oncology question, actually. So,
Good.
no, it's right up our alley. So, the carbodoxil is usually an appropriate course. And even if you've had some cardiac issues in the past, it's not the cardiac issue that we worry about with Doxil chemotherapy administration. However, I obviously don't know what your specific cardiac issue has been, and it's certainly a question to bring up to your provider. And if they need to get, there are usually certain specific tests that are necessary while you're in Doxil therapy, and your provider can also get cardiology input or clearance from the cardiologist prior to starting you on Doxil. So those are all questions that are worth asking your provider to get so that you can put your mind at ease. But do know that Doxil for the most part is safe, and most of the time the cardiac issue that's associated with Doxil is not what is encountered routinely by patients. And Doxil actually, it's also it's called liposomal doxorubicin, and it's actually the doxorubicin that is the big one that's associated with cardiac toxicity. And but the whole fact that this is actually basically an encapsulated medication, Doxil, that it doesn't have the same cardiac toxicity, and it actually requires a much higher dose of medication to get to that cardiac toxic level that we usually in ovarian cancer patients don't ever reach. In my 20 years that I've been prescribing Doxil, I have not reached that dose in any of my ovarian cancer patients.